Welcome to the first session of the 8-week series on taping and movement, brought to you by Elastoplast Sport. My name is Paul Hermann. I'm an osteopath and exercise and sports scientist based in Melbourne. I'm the director and founder of Stay Tuned Sports Medicine with clinics in Elwood and Boronia. And last year we celebrated our 20-year anniversary at our Boronia clinic, and this month we actually celebrate our 15-year anniversary at our Elwood clinic. Which just means I'm old and have been around for a while. My role here is I'm the national presenter for Elastoplast, and I'll be running today's first session in this series. We'll talk about some of the other sessions coming up, but before we get started, we do have a little bit of housekeeping, of course, to read you through. So we have 2 Elastoplast representatives controlling today's session in the background. Thanks, Todd and Jared, very much for their work. Because we have several hundred people in today's session, we'll ask you all to remain on mute, please, until such time where we'll open up the floor to questions from you. I'd ask you to direct your question to the Elastoplast admin Q&A, so you can send them questions via the chat mechanism, or raise your hand and one of the Elastoplast representatives will be able to get off mute, and so you can ask your question. Again, because there are literally hundreds of you on there, we apologize if I don't get through everybody's questions. As always, there's going to be a legal disclaimer with this too, so please make sure with any of the products I use tonight or things I demonstrate that you always read the label, always follow the instructions for use, and if symptoms persist or anything goes wrong, please talk to your health professional. So I'm just going to share the screen with you now and show you a little bit of a rundown of what we're going to go on tonight. So this is what we're talking about: returning to sport and how to deal with niggling injuries. I'm going to minimize my little bit there. As I mentioned before, I'm an advanced exercise rehab osteopath and exercise sports scientist. So hopefully later in the session tonight, we'll have time where I can answer some of your specific questions, but this is what we want to try and get through tonight. Here's a bit of a rundown. I want to talk to you about where we have been, what happened to us in 2020, and what happened to our bodies as a result. What do I see in the clinic? I'm coming to you tonight from a very practical and anecdotal experience point of view. I'm not going to bombard you with tons and tons of evidence and research, but a lot of it will be very practical and logistical things you can take back and use tomorrow. So I'll talk to you about what I've seen in the clinic. We have 20-odd practitioners of all sorts of modalities: osteophysio, podiatry, psychology, myomassage, Pilates, yoga, everything you can think of, dietitians, sports dietitians. And I talk to these guys on a daily basis. So I'm going to give you a snapshot of what we're starting to see coming into the clinics early this year, which we can sort of see as a result of what happened to us in 2020. Then we're going to talk to you about decreasing your chance of injury during sport and activity as you return to them. Give you some ideas around when should I see a health professional, and when should I be able to manage what's going on with me, and what are the signs when I should really look to see a health professional and get this addressed. And then I'm going to teach you some exercises, some practical ways to manage your own symptoms when you get some minor strains and sprains, and also some ways to help prevent those happening in the first place. Just going to flick back now. So 2020, what a year, hey? COVID affected us all in various ways. In Victoria, particularly Melbourne here, we had an enormous amount of lockdown. And what that meant was, and is still the case for many people all around the world, is working from home. As I'm sure lots of you can assimilate or can sympathize with, working from home means less than ideal desk setups. In one of our earlier sessions last year, we talked about posture and postural setups. So, sorry, here we go. So last year really hurt us in terms of our desk setup or our postural setup working from home. We didn't have the resources necessarily. If any of you tried to get to or order online from your various electronic superstores, even getting monitor lifts, separate keyboards, Bluetooth mouses, etc., became a bit of a challenge throughout last year. So as a result, what we saw was people starting to adopt more of a rounded posture. The patients that were coming in to see us last year were typically suffering neck pain, headaches, cervicogenic headaches or headaches from our neck, shoulder pain, even hip flexor pain because they've been sitting so much more than usual. One of the things that I recently just completed a podcast series on habit formation. And one of the things that we were just talking about earlier, and we talked about in the podcast series, is that we got out of habit last year. We got out of routine. And I think we underestimate how much we normally are upright, out and about, simply traveling to work. So the average worker, for example, might get up, do their normal routine in the morning, and then walk to their car or walk to the bus stop, to the train station, get out of their car, bus, or train and walk up the stairs to the office, walk into their office. Whereas last year, we finished our morning routine and we probably took 3 steps to our dining room table and sat down. And for a lot of us, that's as far as we got for most, if not all, of the day, particularly when the curfews and the limited exercise availability came into place in Melbourne and other states as well, other places in the world as well. We didn't get the opportunity to get up and get out as much as we would like. So what happens there is our hip flexors remain short. So the muscles sitting at the front of the hips remain short for longer periods than they used to, and they don't get that natural elongation that occurs when we're upright and walking as they would throughout the day. We also, and this is again purely anecdotal, but talking to patients all through last year and early this year, when they get up to sort of go and get a glass of water or go to the toilet, it's a short walk in our apartments and houses. Whereas in the office, it might be down the other end of the floor. It might even be on another floor. So again, all those little incidental steps and incidental periods of activity add up. We just didn't get that. And I'm generalizing, but we didn't get that generally in 2020. So conversely, what we did get was altered biomechanics in postural ways, so shorter hip flexors. We tended to get a little more rounded in the shoulders, so shorter muscles through the pecs, maybe slightly more forward head carriage because we're looking down at our laptop, our computer, our keyboard, our phones a lot more, and just not as much movement through our joints and our muscles. Where does that leave us going into 2021? For some people, and a lot of us are trying to get back into activity, get back into our habits and back into our routines now, we're doing it on what we would call deconditioned bodies. Now, that doesn't mean it's not just that we've lost fitness, but we've lost conditioning. One of the things I talk about with my athletes, I look after, and I'm blessed to still look after patients from 96 years of age through to Commonwealth Games gold medalists and coming up later this year, Olympians. And I am so lucky that I get this wide, diverse range of patients to look after. What's similar from last year amongst the non-elite athletes who couldn't train as their profession is this deconditioning. So again, it's not just a loss of cardiovascular fitness or potentially a loss of strength. It's a loss of condition to the ligaments, to the tendons, to our connective tissue. And then when we go to run, jump, hop, skip, get back into activity, play netball, football, tennis, volleyball, whatever it may be, those tissues aren't conditioned to take those forces, so they're more likely to be damaged. No guarantee, but it's just an increased risk. So what we're seeing again in a lot of the patients that are coming through early this year is as they're returning to activity and returning to sport, we're seeing accumulative microtrauma leading to muscular strains, insertional tendinopathy, so where the tendon inserts onto the bone. We're seeing acute muscular tears and strains from people who are feeling generally okay, so we'll do that hill sprint, and there goes a muscle strain to the quadriceps, to the hamstring. We're seeing this commonly in the clinic. And although people are trying their best to take it easy, it's really hard to get that load pattern of progressive, slow, incremental challenge to our body and to have the patience when we all just want to get back into it and get back into activity. So we need to consider that coming out of a year where no matter where we were probably all affected routine and in terms of habits by that decreased condition. We need to make sure we consider that when we are returning to activity in 2021. As much as we want everybody to get back to activity again, we need to consider our bodies in that regard and try and slowly, incrementally return to the same level of load and the same level of impact that we were experiencing in early 2020. So the general advice here would be things like, if you haven't been running for a while, and this is one of the more common ones we see, if you haven't run for a while, make sure you do some varied environment walks. What I mean by that is do some really hard, fast walks. Maybe pick up some hills, some steps, go some downhills, go some uphills, even sideways, going across hills, so that we get a variety of stress and a variety of load to our muscles, tendons, connective tissue, ligaments, etc. This will help prepare, and do this repeatedly over a period of sessions. If you go walking 3 or 4 times a week, then do this over several weeks. If you only go once a week, then this is going to take longer to recondition those tissues. But do this over a period of time to help get those tissues reconditioned for the load and the impact that they will experience when you do go for that first run. My second piece of general advice is possibly one of the most common things I try and impart on patients and athletes, and even the students I teach. I should explain, I was a university lecturer at RMIT and Victoria University for 15 years, teaching exercise science and rehab. And one of the most common things I would teach them and teach my patients now is running is not a warm-up for running. As soon as you have left the ground, i.e. leaped both feet off the ground, you have to hit the ground again. Therefore, there is the same impact. Gravity has the similar effect whether we are running fast or running slow. It does alter slightly, but we still have to hit the ground. And people often think, well, what I'll do as a warm-up for my runs is I'll run slower. And it actually works in the opposite. The slower you run, the more up and down you go. Therefore, the more impact gravity has pushing you back down. When you sprint, we're in this very longitudinal fashion, so the impact is over a very, very short period of time, and it tends to be a little bit more horizontal than straight up and down. So my general advice here is do a dynamic warm-up before you go for your jog. Don't make jogging your warm-up for running. You will not only perform better, you will definitely decrease the likelihood of suffering an injury during your runs. So a dynamic warm-up, people ask, what is that? Is that static stretching? Is that active stretching? Is it ballistic stretching? Is it joint mobilization? Look, a dynamic warm-up is exactly that. It's dynamic. It's about getting your heart rate up. It's about getting you slightly perspiring and warm. And it's about moving your muscles and joints through the range. If you go to Elastoplast YouTube channel, you'll see a variety of videos on there, and in there are some ones that are dynamic warm-ups. I've got one that I did, which I'll share to Elastoplast tonight, and they can also put on there. And there are several others from health professionals that'll show you ways to dynamically warm up. And I'm going to show you a couple of things tonight before we finish as well. But think of things like lunges, squats, leg swings, arm circles, deadlifts, all this without any weight or load to again move our tissues. Hip gates is another one. Move those tissues through their ranges of motion that they're going to need to get into when you go for a run. This will start getting blood flow into the tissues. It'll start warming them up and making them more pliable and ready to take that eccentric load or that impact load when we hit the ground and the muscle gets a small stretch. It'll make them ready, but also psychologically and cardiovascularly will start to get ready for exercise. It also tends to wake up our little afferent or receptor nerves around our joints, so it increases our proprioception and kinesthetic awareness as to where our joints are in space. And this can help prevent things like ankle injuries, rolls, slips, falls, which occur more commonly when we are fatigued or when we're not quite awake. So we see these, again, anecdotally, we see these slip or fall or ankle roll injuries more so in athletes that are fatigued, the end of their training week, at the end of the day.
That's $500. Ladies, for 10 years further. Time for all 4 hours now, Thursday night for rugby.
We'll just get you to mute your microphones again. Sorry if you're jumping on. Thanks for joining us, those who just jumped on. If you could just mute your microphones, thank you very much. So as I was saying, we do see these a bit more in athletes and people who are fatigued, and whether it's general fatigue or whether it's joint fatigue, and when they're not sort of warmed up or woken up again. So that would be my general advice. Don't use jogging as a warm-up for running. Do a dynamic warm-up, get yourself moving, get your heart rate up, get the joints mobilized, get the muscles mobilized before we start that jog. That's the first thing I wanted to talk about. So where we've come from in 2020, recapping, is a lot more sitting, a lot more flexed hips, a lot more rounded shoulders and rounded posture in general, and a lot of deconditioning of our muscles, ligaments, tendons, and connective tissues. And sadly, all of that predisposes us or increases the risk of us suffering an injury. We'll go back to that slide now. We're going to go through our next one. What do I see in the clinic? Again, I've talked about some of those injuries. Often I see the neck pain, the headaches, quad strains, hamstring strains, and shoulder pain. And I'm going to show you a couple of self-taping techniques later on for quad strains and shoulder pain that you can do yourself. We've talked a little bit about how you can decrease your chance of injury when we're returning to sport and activity. So that dynamic warm-up is really, really key to decreasing that likelihood or chance of injury. The second thing I want to talk about to help reduce that likelihood of injury is around self-management of your tissue health. So by self-management, we talk about stretching after your exercise or sport. So this is where you can do your static stretching. So your stretch holds. So it might be, we're taking a stretch and just holding the muscle there for 30 seconds. That's a static stretch. And they are really helpful and really effective at getting all those fibers that have been pushed together, lengthening them all out again after our exercise. Static stretching also sort of tells our body that exercise has finished. So on its own, when you do a series of static stretching, what you'll find is your heart rate decreases, our sympathetic nervous system decreases, our adrenaline decreases, and blood flow to the periphery and all of our active muscles decreases. And this is what we want to tell our body when we've finished exercising. This is why if you do a whole series of static stretching before performance, we've seen in the research that it really doesn't help performance and can in some cases decrease or hinder performance. But it is perfect for after exercise and after performance. It again will help tell the body it's time to calm down, time to rest, time to heal, time to lengthen and elongate those muscle fibers again. So static stretching after sport, fantastic. The other way we can self-manage is via things like my little friends here, foam rollers. Getting on your foam roller and massaging out those muscles, lengthening everything out again and working through that can really help. Our spiky balls can help, or our tennis and golf balls, getting them into the muscles, rolling them around on the base of your feet. Those sorts of self-management techniques. And these days, the massage, the percussion massage guns, they can be really helpful as well. These are all just methods that you can use to self-manage and look after your tissues in between your training sessions. Now, when I say this about the static stretching, I always get asked by my athletes, so we shouldn't do any static stretching before sport? No, of course not. This is not a clear black and white do and don't. It is a advice piece that if you do a lot of static stretching before sport, you're essentially telling your body that we're kind of done and we're time to calm down. But even as an athlete myself, if I've got a very tight muscle and I'm going out to play, I'll do a dynamic warm-up. If during that I notice, gee, that calf is a bit tighter than the other one, I'll give it a static stretch and then give it a warm-up again. Okay, so I'll lengthen it out a little bit, give it that static stretch, and then lengthen it out and warm it up again to focus on any isolated niggles, I'd say. but I wouldn't static stretch my entire body before performing. I'll keep that for after the sport. Again, foam roller, spiky ball, tennis balls, soccer ball, squash balls, all those small little tools that help us mobilize and get into those muscles. And the massage guns these days are fantastic. Personally, when I play beach volleyball as an athlete, and if I've been training for hours, maybe I'm a little bit lazy or getting a little bit old, I can't be bothered getting on the floor on my foam roller. The massage gun is perfect. I can sit there, have my chocolate milk, and just massage through my hip flexors, quads, etc. So those are some ways. Again, we've talked about our warm-up pre-exercise. We're talking about our self-management after exercise. And of course, if you feel like, and we'll give you some ideas around when, feel like you need to see your osteopath, physio, massage, myotherapist, I suggest this be done as a routine kind of thing at time to time when you feel like your body needs it as well. But get in there and ask for their advice for things that are specific to your body as well. Okay, let's have a look and see what else we've got there. Okay, so we talked again, decreasing your chance of injury returning to sport, dynamic warm-ups, static stretching afterwards, tissue mobilization, self-management of your tissues, muscles, etc., using massage guns, foam rollers, spiky balls, tennis balls. We can't negate the absolute necessity of recovery as well. Sleep is probably the most underrated recovery tool we have. We heal in our sleep. So when we get into that deep sleep component, which I'm told by the sleep specialists that it's about every 2 hours on a cycle for most people, we get into a part of that where we actually really do a lot of healing. So if your sleep is not great, or you're getting less sleep, so you're not getting quality or you're getting less quantity, you may be suffering by not letting your body go through its normal healing process. It's really important that we get decent sleep. In my athletes who are preparing for competition and training increased amounts, we have to also increase their rest and recovery. We have to do more sleep or even naps. So I know when I was at the Institute of Sport, we would have our normal sleep routine and we'd have a daily nap and or meditation session to try and just get that extra bit of rest into our body to help it recover and to help it heal. And last but certainly not least is our nutrition. There's no way to put everything back together, to rebuild it, to help heal these tissues if we don't have the building blocks to do so. So nutrition is absolutely essential. I'm not a dietitian. I'm not here going to tell you what you should and shouldn't eat. The one thing I will say is drink lots of water. But yeah, definitely if that's something that you're looking to learn more about, I recommend investing in a dietitian and sports dietitian, getting a dietary advice that is specific to your needs. But good nutrition is absolutely key. Good rest, good nutrition, good warm-ups, good stretching afterwards, and self-management in terms of our massage, spiky balls, etc. Okay, let's keep moving on. When should you see a health professional? What are the signs? This is probably the most tricky question I get asked. Obviously, if your pain is significant, if you feel that there is swelling, if you feel that you can't function for repeated days on end, by that I mean you can't walk properly or you can't do the activities you would normally do of, we call them ADLs, or activities of daily living, cooking, caring, cleaning yourself, then see a health professional. When we talk about pain, it's quite difficult to give someone a scale. If your pain is X, you should see a health professional, because everybody experiences pain differently. And for some of us, pain at 4 out of 10 will be pain at 7 out of 10 for another person. There's nothing right or wrong about that. It's just that we are all wired slightly differently and we all perceive and experience pain differently. My general advice here, however, is if pain persists, as is on the back of many pharmaceutical things, but if pain really persists for more than a couple of days, to me, that's an alarm bell. That's a red flag. Little strains and sprains that occur in your body on a daily basis, or when you go for a run and you're a bit sore afterwards, that'll usually peter off within 48 to 72 hours. If it's on its way out and you did an exercise that you're not used to and you've got that, what I would say, mid-joint pain. So for example, if it's in my arm and it's mid-joint, so it's in the middle of my biceps, middle of the forearm, it's not a rounded joint, and it's that deep sort of ache like DOMS, that muscular soreness. If after a day or two it's decreasing in its pain, I'm okay with that. But if after 3 or 4 days it's not getting any better, or if it's getting worse, that's when you've got to pick up the phone, jump online and book in with your local physio or osteopath, myotherapist, massage therapist, whatever is your choice of health professional. If pain is getting worse rapidly and you feel like you are losing function as well, again, that's another indication. Jump on the phone. If it's really getting worse and is really bad, you might want to jump down to your GP or even to your emergency department and get that investigated further as well. But the tricky ones are in that grey area where we have done some exercise and we've got some soreness. Should I see a health professional? Some of the things that would be red flags or alarm bells, for want of a better phrase, to me are things like I have soreness and it's shooting. It's going down a limb. So I have a shoulder pain, but I'm also getting this pain going down my arm and into my fingers. We call this somatic referred or radiculopathy pain or neurological referred. It's referred pain. So if I'm getting referred pain, that increases the alarm bell level for me, particularly if it's persisting. If I'm getting numbness, tingling in a area that's away from where the pain is, that's also an alarm bell or a red flag for me to pick up the phone and go and see a health professional. So again, pain that's referring away or going down away, and you think, well, I've got pain in my hand, but I didn't do anything wrong with my hand. I hurt my shoulder. That for me is an alarm bell to go and see someone, or if I've got some numbness or tingling. If you get things like back pain and you start getting altered bowel or bladder motions, or you start feeling quite nauseous or sick, that's also a pretty strong alarm bell, and that's an indication to get into your doctor or health professional pretty quick. Okay, there might be something going on that's a little more serious in the back. But for most other pains, joint pains are, if we're around the joint, again, see if it settles down within a couple of days. If not, give someone a buzz, or between joints, so in our muscle, those sort of pains, same type of rule. If it's getting better within a couple of days, body's a pretty good self-healing unit, great. But if not, or if it's getting worse, pick up the phone and jump online to book with your physio, osteo, etc. Okay, what have we got next? I think we're on to some self-help tips. Yeah, so what can we do to self-manage common strains? This is where I'm going to move my chair away, and I hope that you can continue hearing me as I step back here. I'm going to show you a few things. I'm quite a mobile presenter, so when we're doing our dynamic warm-ups, we talk about opening up our chest, lengthening those muscles. For example, this is quite a good dynamic warm-up for the chest muscles and the shoulders. In the terms of the hips, you probably can't see my legs. I'll take this out of the way. But we might do some what are called gates. So we're opening up the hips. If I just tilt this down a bit, you can see a bit better. I'm opening up the hips one by one to try and get some movement into the joints. I might reverse the process and start closing them. And you'll see athletes like hurdlers doing this as they walk down, and then they'll do a big step over. So it's like you're stepping over a hurdle or a witch's hat, something there. I might do some deadlifts where I start to just slowly, with a slight knee bend, stick my butt out and reach down. And as we repeat these, we can't get to the full stretch region or distance on our first rep. So don't expect to be sort of bending down, doing a deadlift and touching your toes on the first rep. If you're anything like me, it takes 5 or 6 just to get going. I might be just at the knees for the first few. And then after 5 or 6, I might get a little bit further. And after 7 or 8, I might be able to get a little bit further again. Ease into these as the repetitions increase. I tend to tell my patients, try and do 10 or 15 of each of these. The first 5 is just getting moving. The second 5, we're starting to lengthen out a little bit further. And the last 5, we might actually get some mobility or some ballistic motion. The example being here, if I do a leg swing, just swinging my leg backwards and forwards, the first 5, pretty gentle. By the time I get to the second 5, I might start to get a bit more motion. And by the time I get to the last 5, that's when I'm just trying to get close to my full range. The one that is commonly missed is in our groin and hamstring, which is swinging our leg across the body. And then I'll try and step back so you can see a little bit at least. So we're taking the leg across this way, not just forward and back. And then you've got your good old-fashioned squats. You know, again, first few, make them shallow, get deeper and deeper and deeper as you go through the repetitions. Okay, so that gives you a bit of an idea around how to do a dynamic warm-up. What would happen, though, if you did actually suffer some pain? Now, I want to pick 2 taping techniques tonight to show you of the most common presenting symptoms or presenting minor strains I see in the clinic, particularly this time of year as we're, at this time this year as we're getting back into activity. And those being a quad strain and an anterior or frontal shoulder strain. Now, I'm not going to be specific in terms of the shoulder tissue, but let's say we've got pain at the front of the joint here, and it may involve the biceps tendon as it's coming up through into the front of the shoulder there. So first off, we might do our quad taping technique. So I'm going to teach you a technique tonight, which is using the Elastoplast Kinesiology tape. That's this one. You can get this at all your favorite chemists, physio places, sports medicine clinics, etc. And with the latest information sheet in there, there's actually a bunch of taping procedures. So in each box, there's a heap of taping procedures there, which will help you if you're looking for some reminders on how to do some of these techniques. And also, again, on the Elastoplast YouTube channel, we recorded a bunch of taping techniques and procedures, and you'll find, hopefully, everything you need on that channel. So here's the Elastoplast Kinesio tape. What we always do with our Kinesio tape is round the edges. This is because the Kinesio tape tends to last on the skin for more than a few days, can go up to 5 days. And we don't want it getting caught in our clothes and getting, rolled up on itself. So we round the edges, and that way it tends to stick a lot better. Now, you have to excuse me, and yes, you can all have a little laugh at my expense. I did manage to trim the hairs on one of my thighs. I'm not a cyclist, so, forgive the very Casper the Ghost white legs. But what we're going to do, we'll do it front on, is I'm going to tape, and I'm going to tape my knee in a flexed position, assuming that I have a mid-quad strain. So it's just a minor strain, but we're going to tape this in a flexed position so that we get a bit of stretch through the tissue, so that when the K-tape is on, it allows for some recoil through the tissue and what's called a ripple effect, which will help increase the blood flow to that area and help with the tissue exchange at the site. So to do so, we measure up. There's a big, as you can see on me, I've got a big bony tibial tuberosity here, which is the bony prominence just below the patella tendon. So our kneecap or patella tendon coming down, and that attaches to our tibial tuberosity. And this is where I want my tape to finish. So I'm going to measure that through there and take it up my thigh to a point, not at the top. We're going to be measuring that probably about 3/4 of the way. Then I fold the tape and again cut through so that we've cut the corners off and we're left with this one piece. I'm going to take that there and measure just where my patella is, because I want my stretch to be from the patella and up. I don't want to be stretching much through this region here. I don't want to stretch the tape from the top of the patella to the tibial tuberosity. I just want to lay that down because I don't want to be compressing the patella and I don't want to be changing its mechanics. So much so, you'll see what I've done there is just place my fingers where my patella is and I fold that region together. So that way I've got a distance and I cut straight down the middle of the tape to that point. What that leaves me with is a space for my patella to sit. We always try and avoid touching the glue on the Kinesio tape. It's a zinc oxide glue, sorry, polyacrylic glue. The rigid tape is zinc oxide. The polyacrylic glue is why it's got a lower reaction rate than our traditional strapping or rigid tape, and it's why it also lasts a bit longer. But it does react to the oil from your skin, so we avoid touching that adhesion so that it retains its as much adhesion as possible. So we take the end off, like so, place that over the tibial tuberosity, and then fold it back. And this is how I can get, it's hard to do and look at the camera at the same time, this is how I can get the backing of the tape off. And again, I'm not putting any stress or stretch through that part of the tape. You'll see I'm separating where I've cut the tape so that it goes around the patella. Unfortunately, the color of my leg is quite similar to the color of the tape. I probably should have picked another color tape. Then once I get above the patella, I'm going to put stretch at about 50% through the tape. And at the very top, I'm just laying that down. Okay. We give it a rub because the glue warms up with a bit of friction and heat, and that'll help it stick down. Then I take the roll again, and wherever the strain point is, wherever I feel the pain, I'm going to measure a band about that long. So basically the width of my thigh, not the diameter, just the width. Again, fold them over, cut off the corners, so we've got a rounded end. This time we fold it in the middle so that we can tear that backing paper off in the middle. We fold it back on itself like so. So yeah, I'm still not touching that adhesion. Stretch that, place it over the point where the strain or pain is, and you'll notice the bits just past my thumbs, not stretching them at all, they just go down. So what this does, looking at it from a straight on point of view, is that it puts a cross right over the point of pain. If the point of pain is a little bit higher, simply do 2 crosses, that's quite okay.
Classic.
And we're going to get that ripple effect over, as you can see over there, and I'm not sure if the camera is good enough to see that, but we can already see a bit of a ripple effect here over the top of the quads, but the kneecap is now free, no altered biomechanics, it's free to just do its thing. Okay, and that will stay on even in the shower for up to 5 days. Okay, it'll help, again, increase the blood flow to that area via this traction effect on the fascia and the skin, and that is thought to help increase the tissue exchange or the circulatory exchange at that area. Okay, that's number 1. And again, just a reminder, everybody, if you've got any questions, please send them through to Elastoplast admin Q&A. Number 2 we're going to do is for the shoulder. Now, I'll pick this one second because it's more complex to do. But hey, this is what we're here for. So it's easier. I've got a singlet on underneath. It's easier if you do this with a singlet. So again, we're pretending we've got some anterior or front of shoulder pain here. And the most common reason for this, the most common reason I see in the clinic is the overhead position of the athlete. So as the athlete goes overhead and they get a knock back or they get overstretched, I did a lot with beach volleyball players. So for them, it's getting their arm up as if they're going to hit or spark the ball. But this could also happen in AFL, it can happen in tennis. And again, especially if we're coming out of a period of time where we haven't lengthened those muscles up and we've been a bit rounded, and then we go and try and take it back like we do in sport to that absolute smash position or that hit position or grab that overhead mark, whatever it might be. And I'm sure there's lots and lots of other sports that would involve the same overhead position. So it's really common that we see a minor strain sprain to the front of the shoulder. It might be the AC joint, it might be the biceps tendon, it could be the pec muscle tendon going over the top. I'm not going to get into too much detail about what, more teach you a technique about helping why. So it's that external rotation position and overhead position which compromises the shoulder a bit. So what we're going to do is we're going to do a K-tape procedure for the shoulder in internal rotation. Again, step back, try and do this standing one-handed while looking at the camera. So we place our hand on our hip, and what you want to do is just bring your elbow slightly forward. So don't have it sitting back there. We're going to take it slightly forward. From there, we measure up a distance of the tape that starts from behind, and it's going to wrap to the front of the shoulder just here. So that gives us our length of tape. Again, we fold that down, cut around the corners, and there's our piece that we're going to use. So I'm going to take the tape, I'm going to take my elbow into internal rotation, and you can see I want my shoulder slightly sitting forward in this position. We're going to tape it from behind, posterior to or behind the tricep. We're going to tape it up and around over the front of the joint and finish just at the midpoint of the collarbone or clavicle here. That's our ideal, somewhere around there anyway. I want to make sure that the tape does cover the front of the joint, so it goes over that fulcrum of position of external rotation, okay, where the humeral head wants to push forward or anterior. So to do this, it is a little difficult doing this to yourself, but we're going to take the tape, because I'm going to place it down first before I get in a position. We're going to apply that 45 degrees up and posterior to the tricep. So you can see it's just to the back of the tricep and it's angulated up. And I'm going to grab that backing paper. This is where it gets tricky. Just need the corner of it. There we go. Okay, so once I've got that backing paper, that's when I put myself into that internally rotated hand on hip position. Then I'm going to stretch that tape up and over towards the front of my shoulder, stretching over that position. And again, as always, the ends of the tape have no stretch. So that last bit of tape here, I'm just laying down. And it should line up, middle of the collarbone. Not bad, I do say so myself. Okay, so we're going to warm that up, and that will help the glue stick a bit. And what that does is when I go back into that position, it kind of gives me a bit of resistance and reminder to not overstretch again into that position. If I've got a pain point, similar to what we did in the quad, if I've got a pain point here anywhere, I can again take a small piece, fold it over. So if I've done, let's say, a biceps strain, or I know that the pain point is somewhere here at the anterior deltoid biceps tendon, fold this one over, and we place that. This is where, again, it gets a bit tricky. We place that. I'm going to put it over the front of the biceps. So we let the top have no stretch. I'm going to stretch over the pain region. Yeah, I want that tissue exchange over there. And the bottom component has no stretch either. So I've got the stretch all sitting there across the tape, right over that pain point, where we're going to get that nice traction and the tissue, increased tissue exchange. So hopefully you can see there, it's an internal rotation, hand on hip, elbow forward. So we place it into that internal rotation to try and give us some support and resistance going back into external rotation in the shoulder. If you've got a larger, if you or the person you're doing it to is larger, you've got a bigger shoulder, bigger arm, you could simply use 2 straps for that, no problem at all. And you just try not to, with K-tape, you try not to lay it on top of K-tape, so you'd lay it next to the K-tape. It's amazing stuff, but it doesn't stick to itself as well. It sticks to skin really well. So they're my two advisory taping techniques that you can do for the two most common things I see coming into the clinic post deconditioning, which is our muscle, or in this case, our quad strain, and our anterior or front of shoulder strain. Hopefully they help you, and hopefully if you want to know more, you can go to the Elastoplast YouTube channel. There's heaps and heaps of taping techniques there by myself and a bunch of fantastic physiotherapists from all around Australia who have recorded videos on that channel for you to use. So we're now going to go to some questions. Now is the time. If you've got any questions, please direct them to the Elastoplast admin Q&A, and I'll do my best to answer them. First question, does K-tape mainly help for proprioception, or does it provide structural and or blood flow? So we have we have lots and lots of different types of tape, but if we put them into two categories, there's our kinesio tape and our rigid strapping tape. We then have EABs, and we have leucolites, and we have a whole bunch of, we have Elastoplast Sport, a ton of underwraps and all sorts of tapes for various reasons. But what we're talking about here is functional support versus joint support. So if I was looking to try and reduce the range of motion of a joint, let's say after an ankle sprain is one of the most common ones, that's when I go to my rigid strapping tape, or RST. Okay, so that's our Elastoplast Sport, say a 38mm rigid tape, because it has no give at all. So I can really use it to support the joint and limit the range of the joint to help prevent further injury. The K-tape, however, has about a 50% length through the tape that it can stretch out. So it's not going to provide the same reduction in joint mobility as the rigid strapping tape. We use it more to increase proprioception, as you mentioned, to increase blood flow to the area when we do a cross tape of the K-tape over the top of the injury, and that's thought to increase that tissue exchange or circulatory exchange at the spot. So increased proprioception or kinesthetic awareness, knowing where our joints are in space. We can, as you've seen in the shoulder one, use it to kind of teach our body when it's going too far, to help it to stop it. But if I went and just ripped it right back, it's not going to stop me. It's not a rigid strapping tape. I hope that helps. Let's see what else we've got here. Is K-tape available on the Elastoplast eShop? Yes, it is. The Elastoplast eShop is now up and running. I believe you can find it through elastoplast.com.au. The guys will tell me if I've said the wrong website. But the eShop is now open, and yes, you can get K-tape on the eShop. Elastoplastsport.com.au. How could I get that wrong? I'm so sorry. Elastoplastsport.com.au, and yeah, the eShop is open, and you can get all your various needs on there. Okay, let's have a look at, see what other questions we have, if any. And you can ask anything in terms of specific injuries you want to know about. Coming out of COVID, what are some ways to, hopefully I've given you some broad ways to help decrease the likelihood of getting injuries in 2021, and some ways to know when you have suffered some pain, whether you should go and see your health professional or not. Okay, we've got another one here. Is there a similar approach to hamstring taping as your quad taping? Yes, thanks, John, for your question. Yes, it is very similar. The hamstring, it's a little more challenging to do on yourself, but it is possible. And again, I would start at either starting below the knee joint or towards the glute heel, so towards our bottom, and be stretching it at the most over the site of pain. Now, given that we're looking at a cylinder, you want to put the tape in line with where the pain or strain is. On the Kinesio tape pamphlet, you'll actually see they do 2 strips on the hamstring from memory. Here's where, yes, Goodness, let's see if this little picture shows up here. So we can see there they do 2 strips. So you put the strip over where the most pain is, and then a cross strip over the height where the pain point is, or where the most pain point is, or a double cross strip if it's quite lengthy in terms of the pain site. If it's a generalized hamstring overstretch, then 2 strips are quite useful. All I would say is avoid taping the K-tape directly into the center of the back of the knee. The back of the knee is a fossa, it's called the popliteal fossa, and in that we have a vein, an artery, and a nerve, and we don't want to be putting tape directly over the back of the knee. So we tend to take it to the sides of the knee and then just past the knee joint, but to the sides of that. At the top end, you can go quite centrally, no problem at all. Thanks for your question, John. It's a good one. Okay, we're coming towards the end of our time allocation. I've got a few more questions here. Should I recommend to my women's Aussie rules team to not do the standard 2 laps when arriving at training? Shane, thank you for your question. This is one, as an exercise and sports scientist, I've got to be careful how I answer this one. I have struggled with for a long time at the various professional clubs I've worked for and worked with, and sometimes we'll see, especially in elite sport, that tradition may override science. We find that the best performing athletes and performing clubs will keep an open mind to new research, new evidence, and that in most recent years involves warming up dynamically before we run. So in a generalized way, I wouldn't say, no, don't do the 2 laps. I would simply say, before you do the 2 laps, let's do some dynamic leg swings, squats, lunges, even a simple 10, 15 swings forward and back, side to side, 15 squats, 15 lunges on each leg. We'll at least get those tissues dynamically warmed up before we go for that run. It is challenging and it's difficult, especially, as I say, with tradition. And it's hard to change, as I've just mentioned in some podcasts I was running. It's really hard to change habits, but we have to stay open-minded to the latest evidence and research. It is constantly changing and constantly evolving, and we should stay open-minded to that. So I hope that helps. I do wish you the best with that one. It's always a bit of a challenge. Okay, we're down to the last few minutes, so we'll just take our last 2 questions here. Oh goodness, we've got a lot. Okay, for young sports people, is there a risk of overstretching after sports when using static stretches? For everybody, always there is a risk of overstretching. We have to listen to our body. The difficulty is, young or old, that some of us are less connected or less aware of our body and its responses to stretching. So I would always advise, in general, more frequent and less intense is better than more intense and less frequent. When it comes to stretching, especially, more frequent, less intense is better than more intense and less frequent. So you're better off stretching less intensely, but doing it more often. And okay, best management advice for shin splints. Ooh, I picked a tricky one to finish with. Shin splints is a generic term we talk about, which is usually associated with pain in the lower third of the tibial bone or tibial region there. Not to be confused with anterior compartment syndrome, which is on the other side of the bone. It's on the inside or the medial aspect of that lower third of the tibia, most commonly. Shin splints, like all things, I think, and this answer might help with a lot of other injury questions, we need to always ask the question, why? I'm one of those annoying people that always asks why. Finding out what is usually pretty easy. Finding out why will help us far more long-term. So when it comes to shin splints, I have podiatrists, sports podiatrists, physios on my team that we all work collaboratively together, and we often discuss these cases, and our number one thing is to work out why. So in shin splints, it might be things like, what are the foot mechanics like? What was the shoe wear or footwear like? What was the load pattern like? Did they go too far, too fast, too early? Did they go too fast? Did they go too far? Or did they go too early? And were the tissues not conditioned or ready for it? Were the tissues not ready for it because the support wasn't there, i.e. the footwear or shoe wear? And if those whys are starting to ring alarm bells, that's when I would send them off to a podiatrist, sports podiatrist, physio, osteo to look into that further. In terms of managing the symptoms of shin splints, again, on the YouTube channel on Elastoplast, I believe there are some rigid strapping techniques. If not, we'll add that to our list of videos that we are continuing to work through, because there are some strapping techniques you can do which are really, really helpful at reducing the symptoms of shin splints to allow athletes to continue doing modified training. I hope that helps. Always search for why. Okay, let's wrap it up. So our next session is with the brilliant Sam Ward. Sam's a physiotherapist, and he's going to be talking about, this is on the 21st of April, 6 p.m. Sam's the head physio at Warringah Rugby Club. He's also the director of Physio Ward in Newport, New South Wales. Sam's one of our team here at Elastoplast Sport, and he's going to be talking around sports injuries in kids. So whoever asks a question about youth, this will be a perfect session for you. If you guys have more questions, please send them through to todd.grundle@beiersdorf.com. That's on the chat there. And then we'll come back to you with some answers as soon as we can. Remember, this is a series going along, guys. So please jump on the Elastoplast Instagram page, LinkedIn channel, YouTube channel, elastoplastsport.com.au, and you'll be able to check out the rest of the series. Again, their eShop is open. If you want to find me, paul.osteo.staytuned on Instagram, and via the Elastoplast channels and via Todd's email, you can send me some questions and I'll get back to you as soon as I can. Again, thanks so much for giving up your night. Thanks so much to the team behind the scenes at Elastoplast Sport, and wish you all the very best. Stay well.